You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗏 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗵𝗏. I'm your host, Nicole Jacinto. We're coming at you live from Metro Manila. It's Monday afternoon here, 5 p.m., October 23. And for all of you who are, we are heard live on DZRJ 8:10 a.m. Radio Bandido, and we're also live on DZRJ 8:10 a.m. Radio Bandido TV. So hello to all the listeners and the viewers. And of course, we're on Facebook and YouTube. So anyone who tunes in, whether it's during the show or afterwards, you can keep getting all the information you need about health and the latest medical developments from doctors from 𝗏𝗏𝗵𝗏, from the prestigious 𝗏𝗏𝗵𝗏. And today we have one of them here with us. Our topic for today is psoriasis, and we have Dr. Sharon O. Lim, who is a dermatologist, and she practices, of course, in Makati Medical Center. Welcome to the show, doctor. How are you?
I'm good. How are you? Thank you for having me this evening.
It's my pleasure. That's my pleasure. All right. So, doctor, let's kind of get into it immediately, no? We're talking about psoriasis today. And can you tell me what is psoriasis exactly? Or tell the audience, rather. And me, of course, because I'm learning a lot during the show.
Okay. So, to just put it in layman's terms, psoriasis is a skin disease. It's sort of like eczema in that it is immune mediated. It's not contagious, it's not bacterial, it's not viral. It is something that your immune system just turns on, and it turns your skin, it makes your skin thicker. The turnover of your skin is much faster than it would usually be. Usually it takes about 30 to 40 days for your skin to turn over. However, when you have psoriasis, it takes a couple days only. And so that's why you have compounded skin, and it can be anywhere on your body.
Okay, doctor. Let me pick up on a couple of things you said, because a lot of people will ask this, is it an allergy? And I guess you just said no. No, it's not an allergy, but it's an immune disorder of some type.
Yes.
Okay. So, and well, I guess technically, you jump in anytime I need to be corrected. From my understanding, technically, allergies are immune disorders as well, but it's not an allergy. It's an immune disorder. And you mentioned the turnover of skin. Can we talk about that a bit? So you said 30 days is a normal turnover. Does that mean the shedding of skin in all the areas of our body?
Just about. It's an average of 30, 40 days
Okay.
For our entire body to shed. Of course, your thinner areas, like say your face or your genitals, will shed much more quickly, or it will heal much more quickly, just because there's more blood vessels, and it is just much more efficient at repairing the skin. But in terms of allergy, it's completely different, because allergy is more of what you call a histamine based, and that's why some allergies can be more histamine based, and that's why you take antihistamines. But psoriasis is completely different.
Okay. Yes. And then you mentioned earlier that it takes with people who have psoriasis, it takes usually around 2 days for the skin to turn over. So does that play a big part in it? Like so our skin sheds. Maybe some people don't even know this. We shed our skin. Yes. Okay. So and you mentioned, like, in the thinner areas, I guess thinner skin, and where there are more blood vessels, faces like the facial area and the genital area, is just, the body is just much more efficient at repairing any kind of wounds or anomalies or anything that's there. But when it comes to other parts of the body, the skin, which normally should shed about 30 to 40 days, it sheds every 2 days. So how does that play a big part specifically? Is because the skin. Go ahead. Sorry.
Okay, no problem. Not exactly every 2 days. Usually it takes about 4 or 5 days for people whose psoriasis is what you call in flare, because there are moments, or there are periods in one's life, and when you have psoriasis, that you don't have any lesions. You can be completely lesion free, or you don't have any arthritis or any nail problems, or hair problems. But The turnover is much faster. It takes about 5 days, more or less. And what happens is your skin isn't ready to detach from the bottom layer. So you have this compounded layer of skin. So it becomes this very thick kind of like scale. It almost looks like armor because your body is just making too much of it.
Making too much of the extra skin when the other skin hasn't completely shed off yet. Yes. Okay. Thank you, doctor. And we're mentioning parts of the body. I was going to ask you, in what parts of the body do we usually see psoriasis manifest?
Okay, so I mean, a lot of people don't know that hair and nails are part of dermatology as well. Hair and nails are what you call keratinized skin, so it's special skin actually, and it's enveloped in this layer of what you call keratin, which is what our skin is made out of, and it's sealed so that it creates this kind of waterproof-like texture. And what happens is if you have psoriasis, your hair isn't affected too much. Sometimes you'll have scalp psoriasis. Your hair will start to fall out. But usually in cases with psoriasis, people don't lose their hair, unlike in other immune disorders. But with the nail, you'll see that's one of the things that are affected as well with psoriasis. You'll see things like salmon spots. You'll see your nails will start to crumble. Your nails will also start to thicken. So it looks like your nail is also shedding, and it becomes very thick. So people will think that they have some kind of nail fungal infection.
Yes. Yeah.
Or sometimes there'll be like little pits in your nails or little spots in your nails. That's also a sign of psoriasis. If you have those, it's very interesting actually, because it's been found that if you have any kind of nail psoriasis or involved of the nail, and if it progresses, as we see here, this is your nail starts to crumble because your nail is very weak. So this can be mistaken for a fungal infection, but it's very rare to have a fungal infection that it involves all of your nails. So you can see here the reason that it's white and it's kind of thick, unlike the pink, nice skin that we usually, or nail that we usually have, is because the nail bed, which is the area underneath the pinkish part, is separating. Yes, it's separating from the nail, because the nail is starting to thicken, and you call that onycholysis, or separation of the nail from the nail bed.
Okay.
So that's very common in psoriasis.
Okay. See, that's a great thing to discover, because as you've said, we always will say, oh, it's a fungal infection in the nail. And then sometimes for some people, it just doesn't go away. Doesn't seem to go away. And the nail does get thicker and there are spots. I'm glad we have pictures. Thank you for sending us, the photos for this show, so that we can go through it properly, also as visual aids. And I'm sure for those listening who cannot really see, I mean, they can, they still can imagine a nail that's thickened, that's probably broken off, that has some spots in it, that just seems to get thicker. And no matter what they do in terms of I guess, trying to clean it or whatever, thinking it's a fungal infection, that sometimes it just doesn't go away. So that's like a great, you said earlier also that if it's a fungal infection, it's probably not on all of the nails. But if it's on all of your nails, whether it's your toes or your fingers, fingernails, then that may be an indication that it's psoriasis. Okay, so doctor, can you give us some of the common symptoms of psoriasis, or, and like perhaps the different areas where they manifest?
Okay, so when you have psoriasis, it can pretty much affect anything on your body, and that also includes your joints. And it usually will appear as a rash, and I think that's the reason that most patients see consult, is because it appears this is very unsightly rash, and they get very alarmed because it starts to involve the rest of their body. And usually what's common too is scalp psoriasis. People can't hide their dandruff, and that becomes a really big issue. It becomes more of a cosmetic concern. And people have this, they feel this stigma that perhaps people don't want to be near them because they have this really thick, scaly red rash, and they think that if they touch it or go near them, they're going to get it. So our psoriasis patients actually, this is a little bit off topic, but they too do tend to develop psychosocial problems. They become anxious, they become depressed. Just because, you know, as humans, we're social creatures, and as Asians, as Filipinos, we love gathering in communities. And when you tend to stand out because you have this kind of skin rash, you become almost like ostracized because people don't understand. So it can involve anything. And what's most difficult about psoriasis is not just the external, but the internal as well, because they develop arthritis. And what's very scary about the arthritis of psoriasis is it tends to deform your joints permanently, to the point where you can develop what you call arthritis mutilans, and your joints are basically all deformed, and your fingers, instead of them being straight, they can become wavy. And then once that happens, it will never go back to what it once was. So it's important to be aware. Here we have a picture here. I mean, this is quite like chronic. This is quite bad already. You can see there's nail involvement, there's a rash. And of course, you know, your toes aren't supposed to look like that. So this is also, there's arthritis also. So you have not only arthritis in your toes and your fingers, but you can also develop arthritis in your back, in your knees, in your hip, and sometimes in your cervical or your neck spine. So it's very important to treat your psoriasis and to ask these questions of yourself and seek proper consultation so that you can be screened for all of these things.
And when we're talking about the different body parts, you did just mention the joints and then also the cervical or neck area and the spine. Can we dig more into why do you get arthritis because of the psoriasis? It's not something that's happening inside but outside, and then it deforms the inside?
It's happening more on the inside. And then you have inflammation in the joints, and then it tends to eat away at the bones and the cartilage, and that's why you have the deformity. So our main problem, as with every other disease, is inflammation as well. And people with psoriasis tend to have a very increased rate, I guess you could say, of inflation, is what I noticed with my psoriasis patients, because it seems that they're very sensitive, even though they say that they're not allergic to anything, or when they touch things, they usually don't have any kind of reaction. But sometimes when their psoriasis is in flare, if they put on their usual lotion, they will notice that it will sting more, or it will develop more of an inflammatory reaction. And that's just because of not just the inflammation and the immune system, but because the barrier of the skin is broken and it can't seem to repair itself.
All right. Okay. So that's a great point. Like, because again, people will always relate it to an allergy. And earlier you were mentioning some psychosocial effects, which we can get more into later. I'd like to circle back to that because that's like really important. And then, but also like, can we ask straight and bust the myth? Is psoriasis contagious or not? Right?
No, not contagious.
Yeah. Yes. Getting to the psychosocial stuff, like, yeah, it's not contagious, guys, but there is an effect on how people react to it. And of course, you know, a lot of people think it's contagious. So two things we've fact or fiction, doctor said it's fiction. It's not allergy and it's not contagious. Okay. So some of you've described some of the symptoms, and that can include arthritis. Is it are there other symptoms that come along with the rest of like actually than just seeing this? Is it itchy? Is it painful in certain areas? Or do you experience like a whole overall body thing as well? Like, do you get do your patients or whoever you've come across any patient who has psoriasis, do they like identify other symptoms as well? Like, with other illnesses, they're like, oh, I feel dizzy too, or I feel weak, or, I feel pain in this area. Are there any?
That's a very good question. A lot of patients will always feel itchy, and like the itch just doesn't end. And it's an itch where it doesn't stop feeling itchy until your skin is broken, and then it becomes painful, and then it gets infected. So it's this really vicious cycle, just like eczema. So to answer your question, and then another thing with psoriasis is that you tend to, or patients with psoriasis tend to develop what you call a metabolic syndrome. Okay. So that means that you're more prone to developing cardiovascular disease and developing diabetes as well. And that seems to be a big problem with our psoriasis patients. The majority of my psoriasis patients tend to be a little bit overweight because they deal with their psychosocial problems and emotions through eating. And then they're too embarrassed to go outside the house because people are just going to reject them or shun them, when really we should be empathetic or sympathetic to them.
I agree, doctor. Okay, doctor, we've gotten into the subject and we're fleshing it out. We're talking about psoriasis on today's show. We're just going to take a short break. And when we get back, I'm going to ask you, apart from what you've already told me, what exactly causes it, and other questions like, is it hereditary? Because people want to know that as well. Sure. Okay, so we're just going to take a short break. We'll be right back. Stay tuned to Healthline with Makati Med. We have a great guest today. It's a great topic, and we should touch on it because a lot of people have psoriasis, and we got to talk about all these different things that are affecting all of us. Whether it's us ourselves, someone we know, or you meet people, and we get to learn a lot about how to uplift ourselves in a healthier manner, not just through like plain science medicine, but as well as how to deal with things. So stay tuned. Healthline with Makati Med. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗂𝗏𝗂𝗁 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗛𝗶𝗁𝗵𝗹𝗁. Available for outpatient care services, our 𝗛𝗶𝗁𝗵𝗹 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗛𝗶𝗵𝗵𝗋 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗛𝗶𝗵𝗵𝗋 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗛𝗶𝗵𝗵𝗋.
You're back with Healthline, keeping you healthy, moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We are here with Dr. Sharon O. Tan of Makati Medical Center. She is a dermatologist and the expert that we are talking to today regarding psoriasis. So we've asked a few questions already, and just before anything else, I'd like to let you guys know that I have an allergy. So if I have to blow my nose, I will. Try to do it off cam, but it's just there. All right. So, everybody has something, right, Doc?
Yep. No worries. I have that too.
Okay. Yes. All right. So earlier we talked about how psoriasis is actually an immune system disorder, how it has a lot to do with when it manifests on the skin. Like a lot of it, you can see it manifesting on the skin and certain body parts. And it's about, the skin, it's not behaving the way it should in terms of making the speed of making new skin in order for the other skin that's shed off, so it thickens. And that's why people with, and please jump in anytime to correct me.
You're completely right. It's just basically your skin is it can't wait its turn, and it just wants to keep on stockpiling. So you have this extra armor on top of your regular skin, and then your body just doesn't know what to do with it, and then it gets infected, and then it gets swollen, and then it just becomes really unsightly.
Yes, and as you mentioned, the vicious cycle of when I asked you some of the symptoms, yes, it gets itchy at first, and then when your skin barrier breaks, it's painful. And then there's another layer coming on after that. So there's another new layer that's not exactly needed, but it's there because our immune system thinks we need it. Yeah. And you also mentioned the psoriasis that's happening from inside, causing our joints to, giving us arthritis and causing our joints to become deformed, and once they are deformed, they will never go back again. Okay, so one of the questions, or a couple of the questions I asked you earlier, straight on Mythbusters: 1, it's not an allergy; 2, it's not contagious. And we'll circle more back to that later when it comes to the psychosocial, because that's very important, I think, in understanding this disease and also helping out people who have it. And knowing this for ourselves so that we can be more enlightened. Okay. So, doctor, is psoriasis is it hereditary?
Yes, it is genetically inherited. It's not 100%, but it has a pretty high likelihood that you will be you'll get it. Actually, it's 23% chance to 30% chance of inheriting psoriasis. And sometimes I'll have patients and I'll ask for the history, because usually if they have a history like psoriasis, just like with your diabetes or just like with your cardiovascular disease, there is a genetic predisposition. And so with patients who have psoriasis, they do have the genetic predisposition, but sometimes you have your triggers, which will influence your genes, right? So it's always a question of nature, nurture. And with psoriasis, it's exactly the same. With psoriasis, if you have, if you smoke a lot, if you drink, or actually if you smoke, period, or if you drink excessively, I guess, then you will most likely trigger a psoriatic flare. So that's very important. And your diet too. Some people like to have a lot of fast food and a lot of instant food, and that's not the most nutritious. And sometimes it can cause inflammation in your gut or inflammation in your body, and that can also help to trigger your psoriasis. Yes.
No, sorry, go ahead.
Alcohol is known. Alcohol is a big no-no. Smoking is a big no-no because you have a little bit and it will trigger your psoriasis. So, and then another trigger for psoriasis, if you have psoriasis, if you've been diagnosed, it's been found that if you get sick, that's a trigger for your psoriasis. You have a strep throat, you have an infection in your skin, that will trigger your psoriasis. And it's funny because it's been found that psoriasis is one of those diseases that wherever you get an injury, you'll trigger a psoriatic rash.
Okay, wherever you get the injury, you will trigger the rash.
Yeah, say you cut yourself, even if it's a paper cut sometimes, or if you scratch yourself and you get cut, or if you fall and you skid your knee or you skid your shin, if you have psoriasis, you will grow a psoriatic plaque there.
I think there's a photo for that. Perhaps we can.
I think so. It's a special word called 𝗂𝗶𝘁𝗵, named after the person who found that out. And it's a very interesting phenomenon because it also exists with patients who have vitiligo, which is also another immune disease. So very interesting.
Okay.
So I'm not sure if we have a picture.
Yeah, AJ, I think we have a photo. He did mention if it's called plaque, if that's what you can show it now. Thank you. Is that it?
Yeah. Well, this is not necessarily a picture of 𝗂𝗶𝘁𝗵, but more of a picture of there are several different kinds of psoriasis.
Yes.
So this is your plaque type psoriasis, and it looks like scales, looks like armor. It looks like this, and you can see like the white, you can see the thickened white, yellowish crust. So those are the scales that I'm talking about, that you have this overlay. It's like tiles, it's like bricks. You have this overlay, and you have this whitish sheen to the skin because it's like paper. Like when you hold one piece of bond paper, sometimes it can be pretty transparent or translucent. But if you start to combine multiple sheets of paper, you'll notice that the sheets of paper will become a little bit whiter and whiter. And that's exactly what your skin does. So earlier you showed another picture. So this is your guttate psoriasis. And you see it's guttate because you see those small annular.
Maybe you can show the pictures later when we go through the different types of psoriasis.
Okay, sorry for getting ahead of you. Sorry.
Yeah, no problem. Okay. We're just going through this. Okay, out of nowhere, doctor, you said earlier that one of the things about psoriasis is that if you get an injury, one of the triggers is that, sorry, I'm going to go back a little. My mind is like that.
Sure,
okay. One of the things that triggers it is if you get an injury, like let's say you fall or you skid or something, and then maybe you get a kind of bit of a wound or something on, let's say, your leg or your knee because it's a joint. The psoriasis will show up there.
Yes. So it will kind of just get red, and then all of a sudden you'll see, like, why is this not healing like it used to? It used to just scab and then fall off, turn brown and then fall off. Now it's like extra thick, and then it has like extra white stuff on it. So that's a psoriatic plaque.
Okay. Just out of, I don't know, please, jump in, correct me if I'm wrong anytime. Is that because, like, I don't know, does it trigger something in our immune system? Like the skin feels like, oh my God, there's an injury here. I have to make more skin because the skin got affected. Could it be something like that?
It's exactly that. It's like, okay, you have an injury, so there's inflammation everywhere. And so the inflammation would be like, let's cover it up with like 20,000 pieces of gauze.
Yeah, to make sure that it's okay, right?
Yes. And then there's like no foreman saying, no, that's enough. You're using all of our supply. Like, stop already. So it's like you have this massive mound of white stuff because you have this initial insult, an initial injury with the inflammation.
Yeah. And folks, when we talk about insults and that's an injury, like a physical. Yes. No. It's really not. I mean, you're perfect. I'm just like, I'm not a medical professional, so I get it. Like if you get an insult to the brain, you're like, what? You insulted my brain, you insulted my skin. No, not that way. Another way.
Yes, you're right. Okay. Sorry about injury. Yes.
No, it's okay. I mean, you said it perfectly. I'm actually really enjoying my conversation with you. So I'm learning so much, and
I'm glad.
Thank you. And also earlier when we mentioned hereditary, if it's hereditary, you said that of course there's genetics involved, and you inherit it, and you said it's a pretty high rate, like there's a chance 23% you mentioned, I think, but just to get a little bit more into that, so people like me understand a bit more. You did say it's nurture versus nature, right? So it's things that trigger it. But would I mean, can you be a bit more specific? Like if it's only let's say one parent has it, or does it skip generations and like, oh, your grandfather had it, so you might have it, or your aunt has it, so you might have it, or could it be like coming from one side of the family, or do both sides of the family have to have it for you to inherit it?
That's a good question. It's actually not very well understood how it is passed on, and because we all have genes and we all have expression of those genes.
Yes.
So if you have like a good healthy lifestyle, but your parents have psoriasis, of course, if both parents have it, you're just at a higher risk for developing psoriasis. And if they also develop psoriasis at an early age, or if you develop psoriasis at an early age, usually your psoriasis will be much more severe. But there are some patients who I have, and they're like the first person in their family to develop psoriasis, and they're like, I don't have it in my family, why me? And sometimes it's just the gene, that you have the gene, but it just picked you to get expressed. It picked you to be the poster child for the expression of the psoriasis. And it could be because of a trigger. It could be because you've been smoking or you've been drinking, because as we know, those are all kind of toxins. So those things can trigger an immune reaction and turn on your genes and say, hey, your psoriasis is now going to flare.
Yeah.
So very rarely do I have a patient who doesn't express the psoriasis lesion or rash. If one patient has it, then you have about a 30% chance of inheriting it. So you're still good. You still have 70%. But if you have two parents, the higher the likelihood that it will be expressed. Okay.
Thank you, doctor. And just because you mentioned lesion and rash, can you tell our audience the difference between the two?
Sorry, lesion is just our dermatologic way of, it's just our fancy speak for saying rash, because for us, what we see is very different from what the usual person sees.
Yes.
When you say rash, we say what kind. Does it bubble? Does it have water? Is it hard? Is it brown? Is it pink? Is there swelling? So there are very many different ways of describing a rash. And sometimes to be a little bit more scientific, we call it a lesion.
Okay.
So it's the same thing.
Okay, it's the same thing. No, that's great, doctor. I mean, of course, when it comes to you guys, you're like, okay, what kind of rash is it? Is it like, does it look uniform? Of course, because you need to know these things and you identify it in different ways, and you're more detailed because you've studied this, and it's different for everyone. I mean, people can come to you with like a certain type, or another type. And for us, we were just like, oh, it's a rash. I mean, it's the same thing as saying I have hives as opposed to urticaria, which may be similar, those other things. When it comes to like topics of allergy, sorry, it's just, the allergies again. And okay, doctor, you mentioned alcohol, big no-no, smoking, big no-no. Why? Exactly.
Because it's a toxin and it causes inflammation in your body. Usually we're not supposed to, sorry, 1 second.
Sure, go ahead, no problem. No problem. All right. So folks, as you're tuned in, doctor just attended to something. We're talking about psoriasis, and the expert here is Dr. Sharon Olim. She's very informative, and I am finding the show very, very educational. And we've discovered like what exactly psoriasis is. It's an immune system disorder, where it usually manifests, and why in those areas, because of the thickness of the skin, or like perhaps less blood vessels there. And we're talking about now some of the triggers for psoriasis, and we are just talking about why alcohol and cigarettes. Okay, sorry, doctor, go ahead.
Sorry, my son.
Okay.
Usually if you cigarettes have a lot of toxins, and it's like it has that horrible label with all of those hideous pictures on it, and it has so many toxins in it and carcinogens in it. And alcohol is the same. Alcohol is a toxin as well. It must be detoxified by the liver. So all of these things cause inflammation in our body. And it's the same as if you get an infection as well, that will trigger your psoriasis. So those are the reasons that you stress your body out.
Yeah.
Basically, that they have to fight off this stressor in the form of a toxin or in the form of an infection, and then it reacts and says, "Oh, I'm gonna make my psoriasis flare."
Yeah, it says, "Okay, you're taking in these things. I recognize them as toxins, so I'm gonna make more skin because that's my job."
Yes,
kinda that way.
Yes.
Okay, to put it for like plain speak for people like me. Okay,
Yes.
You did mention earlier, a lot of people eat fast food, and we'll get to the more like what we can do lifestyle stuff a little bit later. We'll touch on that. A lot of people eat fast food, and that can cause guttural inflammation. So like it goes up to that level. Like I guess like, if you drink or eat something and you've got, I don't know, not the right bacteria in your stomach breaking it down. So it can be associated with everything that you take in, whether it's a smoke through your lungs, and then it goes through the oxygen in your body, or a drink or some food. You mentioned it's not a very healthy lifestyle, and because we know that the food is processed and there's so much monosodium glutamate, MSG, this flavorings and all of that stuff. If you're, how people say, oh, I ate something and I feel bloated. So that could cause psoriasis, because you may feel bloated, but when you talk about guttural inflammation, can you get a little bit more into that?
Okay. All right. So, I don't really my disclosure is that I don't know too much about the gut and inflammation, but we do believe when it comes to the skin, you are what you eat. Like you can see on the outside that if you don't have a healthy diet,
yes,
and you don't get the nutrition that you need to, your hair will fall out. Your skin will have rashes.
You can see that on my face right now, can't you, Doc?
No, I can't. I can't see anything.
Okay. Sorry, go ahead.
No worries. So, you are what you eat. If you eat things that are unhealthy, you don't really get the nutrition that your body needs. And, your body has to fight off a lot of stress. I mean, who isn't stressed, right?
Yeah.
Who doesn't have a million things that they need to do, or they're worried about something, no matter how big or how little. We all have to deal with a little bit of stress every day, a little bit or a lot. And on some days, it's just so much. So it
Yes.
does become quite overwhelming. And if you don't eat properly and you don't eat the right food, then you don't really have the fuel to deal with all these things. You need to have the proper nutrition for your body so that it can absorb what it needs so that you can do what you need to do. So when I say you really need to have vegetables, you really do need to have vegetables, or you really need
Yes.
to have fruit or whatever, and stay away from, refined sugar is actually known to cause inflammation. So when you have things like high fructose corn syrup in your soda, or if you have a lot of chichirya, if you have a lot of chips, I suffer from that too. I love my sweets, I love my chichirya, but in moderation is okay, just so that you don't go crazy. But
Yes.
know that your body needs, those things should just be a treat. You
Yes.
should really try to eat a healthy, balanced diet. When I mean is you eat like chicken that's not always fried,
Yes.
beef, fish is very good for you. Fish that's not too much deep sea fish, because that also contains some toxins like your mercury, your tuna. You're not supposed to have too much tuna. I think that's something that's not usually addressed. So all
Yeah.
of those things that you eat will inflame your gut. And of course, here we have inflammation again.
Yes.
And so if you don't eat things, because you can have what you call an inflammatory diet and an anti-inflammatory diet. So usually, things that are high in antioxidants, that are high, like blueberries. Well, it's so expensive to have blueberries here, but your deep leafy green vegetables, like your spinach. Kangkong doesn't have too much nutritional value, although I know everybody loves kangkong.
Yes.
Sorry,
Kangkong.
guys.
Butter spinach. But
Sorry,
it's
guys.
okay for fiber. Or it's better to fill you up than chocolate or something.
Yeah, but the best really for fiber is not just your deep leafy green vegetables, but your fruits. Your pineapple. Don't have too much pineapple because it's, if you're acidic, then that's a problem. Your pongkan, your pomelo. My cousin taught me this too. As we get older, you need to eat more fiber. So a lot of fruits, watermelon, those are great. Yeah, because they have a lot of antioxidants, a lot of citrus fruits. Papaya, yes, papaya.
Banana?
Banana, not so much, but it's good for your sodium, potassium, your banana.
Yes.
Like if you work out, then it's good to have a banana after, because your body gets depleted of the sodium and potassium. But all of these things that they're what make, they're fun things to eat, and they will help your body, as opposed to, we're all always so pressed for time.
Yes.
And I think diet is what we neglect a lot of.
I
So, we usually get things that are quick or easy. But I think most Filipinos aren't used to eating a sandwich, or we want rice and sauce.
Yeah.
That's the best.
I love sandwiches, by the way. But of course,
that's great.
they're like the Reuben. Probably, would I recommend that, or like a VLT, take out the B and make it healthy. Well,
you can have a little bit. It's okay. You shouldn't deprive yourself. A little bit is okay.
I can't believe Carnegie restaurant closed in New York. I'm like, the Reuben, but not there. But
yeah, it's hard to find a good Reuben sandwich. It's hard to find.
Yeah, it is.
Yeah, it's always too salty.
Always too salty. There's not enough of this, or too saucy. Yeah.
Yeah. The bread's so hard. It's like a rock. That's what I noticed. But yeah, try. You can eat it. It's fine. Just maybe put more sauerkraut then.
Yeah. Oh my God, I love sauerkraut. I love pickles. I'm like, okay, that's kind of sour. I shouldn't have eaten that. But
it's yummy.
Yeah, I do
So
love
that's very good for you.
pickles.
Yeah. So
Pickles?
achara. Yeah. That's more relatable. Yeah.
Oh, kung hindi, you guys, kung hindi kayo mahilig sa pickles or yung mga sauerkraut, achara, that's basically it, diba? It's pickled.
Yeah. Or you want to have a Thai salad, a green papaya salad. That's good too.
And then there's also like, how about like kimchi?
Sure. No problem. Yeah, it's better than eating quick dried, ramen, that's like no nutritional value other than salt. And That's not good for your bowels and your gut because it will just cause inflammation. It's all artificial.
Yes.
So I think in a way our country is also blessed because we really can't afford GMOs or genetically modified seeds. So a lot of what we do is kind of organic.
Yes.
So I think in that way we're a little bit blessed.
Yes.
So if you I know it's so expensive to just get regular produce and meat and whatever.
It is.
So expensive. But if you can stick to that diet, that's basically the healthiest for you. I don't think maybe bok choy or spinach is a little bit, or squash is great for you.
Bok choy is not good? You wouldn't recommend bok choy?
No, that's good for you.
Oh, it's good. Okay, great.
Sorry.
We love bok choy.
Sorry.
Which is
so
echai, right?
Echai. Yeah, echai is great for you.
Okay.
Repolyo is good for you
Repolyo,
too.
cabbage.
Yeah, cabbage is good for you. Not too much though. I mean, just enough.
Yeah. Or we fart the night away. I said it.
Yeah. Well, no, because it can cause thyroid issues too if you have too much.
Yes. Okay.
You don't want to, but it's yummy with sesame dressing.
Really? Okay, I'm gonna try that. Yeah. Okay, I'm gonna try that. Okay, so basically that's why. And like we've touched into a little bit of a lot of the, how we can make lifestyle changes, but I'll remind you more of that a little bit later on so that it's just like stuck in our heads. We'll focus on that too. And then focus on it even more. Okay, so doctor, we're talking, for those who like have psoriasis or, don't have it, we want to know, how is psoriasis diagnosed? Like, how exactly do you diagnose it?
Good question. So there are two ways. So clinically, you can diagnose psoriasis because it's very distinct. But if you have any kind of, doubt in your mind, or if you want to prove to your patient, yeah, this is really psoriasis, then you do a biopsy.
Okay.
You take a little, piece of skin, send it to the laboratory. And I just want to insert here, what's great about psoriasis or psoriatic arthritis is that you can apply for PWD because it is recognized for that.
Oh, okay. Yes. And that's great. Thank you for letting us all know that, because it's already difficult enough to live life with an illness. And if you can be recognized as a person with disability for that, there's nothing shameful about being a person with disability. It helps a lot. And I'm sure psoriasis affects work and the capability to earn. And also because of the psychosocial, issues that we'll get more into a little later. So, clinically, when you say clinically, just reminding the people, that means if someone comes to you, you can tell by looking at it. You yourself can tell. Oh, by the way, how do you see patients with psoriasis? Do they come to you first because it's a skin thing, or do you skin thing, or do they get referred to you? Like, how do you usually come up with patients in your experience?
They'll usually come to the clinic because they have a rash. There's a lot more psoriasis awareness now. There's a sore walk every year that we do. There's a sore club. There are organizations. So a lot of people are more aware. They'll probably Google it. TikTok is not the best source. So I'd like to everybody, please TikTok, because you can't teach in 20 seconds. And, it's like, please don't listen to all of your TikTokers, please, because it takes years and it takes a good conversation about psoriasis to really understand. And most patients will come in the clinic. I say clinically because it's a clinic setting. They come to see me at the hospital or an outside clinic. And that's where that term comes from. So they'll come because they have a rash, but they kind of have already done a little bit of Dr. Google. Yeah, and they'll kind of already know, I think it's like this.
Yeah.
So sometimes they'll come in and tell me I have psoriasis.
Yes.
And I'll say, okay, let me see.
So are you like more patient now with Dr. Google since you've become more acquainted throughout the years? Or do you get like,
No, not really. I mean,
not really.
Not really, because it really takes a clinical expertise.
Mindset.
Yes.
Okay.
Yes.
So just for people like me out there and patients like me, I think sometimes you may know what you have, and it's good to research as much as you can, But do listen to your doctor when they're talking. Explain everything. And there are doctors like Dr. Sharon Lim here who will listen to you anyway and will take in the factors of, Dr. Google. But you will also, like, since you are a doctor and you're not just a machine answering to an algorithm or information put out there, you can check the patient clinically. So physically, you can see it and you can determine. And as you said, you can also diagnose it by taking a biopsy. So you just take a little piece of, do you take, like, have you been in a scenario where you've taken different pieces of different parts of the body? I mean, like, because psoriasis here, psoriasis there. Yeah, okay. So it can be like one part or another part, and then you send it to the lab. And Makati Med, of course, has this lab that can, test it. And then you said for psoriasis that causes or has to do with arthritis, how do you test for that? Is there a specific, like, blood test, or you can also test for that if you suspect?
You can, what usually we can do is we refer to the rheumatologist, and then we co-manage the patient, and they usually order a bunch of lab tests to check for the inflammation aside from the lab tests that we order. And then we also do x-rays, because on x-ray you can see inflammation, you can see the joint deformation, even if it's just starting. So sometimes we'll have to refer as well to ortho to see what can be done early on. If we catch it early on and inflammation is not so bad, we can do a little bit of physical therapy, and that will help. So I think with anything, the clue or the thing is to catch it early, to take care of it early, so that you won't have a bad quality of life.
I think you hit the nail on the head again when you said clue, because I know, like, I've been saying it a lot on the shows, as doctors, you act like detectives, to get all the information you need. So I'm just reminding people like me and people I know out there, just be honest with your doctor and tell them everything. They're not going to judge you. You're not going to judge. If I walk into your clinic, you're not going to judge me, right? I mean, no, because they would know that, like, if you say, oh, I know I'm hiding my alcohol from someone, well, tell your doctor. I'm hiding my smoking from someone. Tell your doctor, so that they have all the information they need. That's just my reminder to people out there.
Thank you. Much appreciated.
I mean, you should tell your doctor everything, I think. Anyway, they somehow you're going to find out it's going to make you feel better. If you can, and you should have all the factors. So those are the medical procedures, basically biopsy, x-ray. I often get into this part of any medical procedure because a lot of people are afraid of tests, and the pain or the stress that comes along with thinking, oh my God, what kind of test do I have to get? So with you, it will be like, of course, you ask them questions and you can see it, the physical manifestation, and you could do biopsies and, just get a bit of that, a little piece of my heart now, baby. No, just a little bit of piece of psoriasis, baby, and then go have it tested. And then also, if you do have to refer to, you work as a team, right? If it's an arthritic thing, you do refer to rheumatologist. I mean, they will take x-rays, and perhaps so will you. You can order them as well. And they, maybe, I don't know, a rheumatologist might have a blood test involved, but okay, I'm not going there because I'm not a rheumatologist. And, but these simple things can tell you if you have psoriasis or not.
Yes. And also the other test that I will run, because I mentioned earlier that psoriasis patients are more prone to metabolic syndrome. So I will run, fasting blood glucose.
Okay.
I will run an HbA1c to check their glycemic control. I will run liver enzyme tests to see how their liver is doing. So there's not really too much you can get away with, since with the doctors, with dermas, we're very visual. So if you show it to us and you say, I haven't been scratching that, but what we see is different, we'll be like, are you sure?
Maybe somebody else scratched it for you.
Are you sure? I mean, you can tell me it's okay. But I think what you touched on earlier is very true when it comes to diagnostic procedures or laboratories or x-ray. what's very worrisome for most patients is the waiting to find out the results. And then they see like if this is elevated, they see the arrows, and then they're like, oh my God. So I think the earlier that you know about it, the better it is, so that you can do something about it. As opposed to just let it fester, and then it becomes so complicated, then you really have something to worry about.
And then I'm talking to a few of my friends here who will eventually tune in. I know what they do. I know what you do, and I'm going to tell to the whole world, but I won't mention your names. You act really good before the blood test for about 2 weeks. And then, because you want to pass the blood test, and then afterwards, you just go nuts. And I'm like, just take the test when you're acting your worst, because if that's your real, see, like, I'm not judging you guys. I'm just telling you, like, that's my opinion. Like, you should know what the real thing is. And then okay, you did just mention, okay, glycemic test, that's a sugar thing. 𝗛𝗶𝗶1C, that's also a sugar thing. And that can be taken through a blood test. Is that through a Chem23 or a Spec23?
Yes.
Okay, so if you take that test, if your doctor, like Dr. Lim here, tells you to take that test, then there is some fasting involved. So it's not a big deal, because, you know, if you get it early in the morning, it just, you know, for once, sleep 12 hours. Just have the freedom to sleep 12 hours, right? 10 to 12 hours is there, or 12 to 14. I don't know what depends on the doctor, the recommended thing is, because for that, you do need to fast. And the 𝗛𝗶𝗶1C, and then do you also look at things like the thyroid, like order a thyroid test at all?
Sometimes we do, but for psoriasis, we usually don't.
Okay, for psoriasis, usually don't. All right, so none of those TSH, T4, T3 things yet. Okay, so okay, all right. Can I intern with you, Nosh?
Sure.
Okay, I'm gonna take you up on that.
Sure, I'm gonna ask you a lot of questions.
Yeah, maybe and you know, if you'd like to come back anytime, talk about psoriasis or any other issue, as you said, you can't really learn something in 25 seconds or 30 seconds, and that's why we have the show. Please come back on the show, doctor. Insist.
Okay.
Insist on it. I mean, you know. And I'm going to type my number in the chat box after. And if you wouldn't mind giving me yours, of course, I'm putting you in the spot because I'm asking in front of everybody, but you don't have to. Then, you know, we can like be more in touch with each other. And I can definitely recommend people to you for either serious or, you know, other things that a dermatologist would treat. Okay, so a lot of times you get walk-ins and people say like, I have psoriasis. Okay, so it's because it's a skin thing. And sometimes it starts out as, you know, a cosmetic issue, doesn't it? I mean, the itch bothers them, but it's like, oh my God, what is this? It comes out, it starts out as discomfort. And then also it's a cosmetic issue. And I mean, do you see a certain demographic of people, like in your experience, in your practice here in Makati Med? I know you know, don't speak for the whole, we already said, yes, it's hereditary. There are triggers. But do you see like a certain demographic that comes into you, that comes into your clinic?
Comes to the clinic, yes.
Yeah.
Comes to consult.
And asks you, and you discover that they have psoriasis. Do you see like a certain demographic perhaps here in the people you treat in Makati Med or in the Philippines?
You know, it's usually the moms who bring in their kids if it starts early, or, you know, because most of us, you know, in our 20s, we kind of still sort of kind of live at home or you know, are still, you know, very attached to our home. So it's usually moms who come in and say, my son or my daughter has this rash, and or it'll be another family member who will refer. Because they also have a similar rash. And, you know, if you Dr. Google and you're right, I'll say, okay, very good, you're right. Now what are we going to do about it? And they're like, I don't know.
Yeah. Okay. So there is a certain demographic. It's the moms bringing in their kids. And yes, people who live in other parts of the world. In the Philippines, we do live at home. Like, I'm still living at home. Like, I left and I came back. So it is a cultural thing. It's also an economic thing. I think, well, okay, not for this show, Nicole, concentrate on the, but
Our next
yeah,
segment. Yeah.
yeah, all of that plays into it. And culturally, it's very acceptable for us to live at home. And there are different reasons for it as well.
Yes.
And, sorry, go ahead, doctor.
No, go ahead.
Oh, okay. All right. So, mom's bringing in, and is it more, female or males who come in?
More males, I think, than females who
Okay.
come in. Some females who have seen other dermatologists before.
Yes.
They kind of just want a second opinion.
Yes.
I just want to briefly touch on sometimes,
Well-
you have patients who go to a derm clinic, and sometimes they aren't, they're more of an aesthetic clinic.
Yeah. Let me be the one to say it, doctor.
Okay, thank you.
So that you don't have to. Sometimes when you go to a derma clinic or derm clinic, of course they use a term dermatologist, but as doctor said, okay, no, I'm not going to say as doctor said, I'm saying it so that, I don't want to put you in a position of like, so I'm saying it. It's aesthetic, it's for cosmetic stuff, and they don't always get that into it or get involved. They don't conduct tests on you that they should be doing, and they don't normally refer you to someone else because they want your business. They'll say this product can take care of that. But there are clinics that are more responsible, and they do say maybe you should see a real doctor. I mean, some of the people there are not trained the way that, doctors like Dr. Sharon Lim are. And they also don't have like, all the x-rays or whatever. And some of the people working there are not like, they can't actually like, maybe they can tell you what tests to take, because I'm like, you should take this test. I'll run it by your doctor. I'm probably like one of your worst patients ever if you had me. I think you should do this. I think you should do that. Although some doctors like it. Some of your colleagues like it when it comes to process. But, they can actually write the order for it or the prescription. So that's probably, same thing with like going to an optical shop, guys. I'm going to compare it to that. Of course, they can give you good service. Of course, also these aesthetic clinics can give you good service. But if it's already a medical issue, you need to see a doctor. And you will know that because it will not stop bothering you. Optometrists are different from ophthalmologists. So I'm just like making a comparison here. There's nothing wrong with being an optometrist. You can tell someone's grade, fix their glasses and all of that. But do you have other serious eye issues where, you need to look into your eye or look at your retina and all of that? I have had optometrists say, ma'am, you should go to an ophthalmologist to check up on that, So there's transparency there, and I can give you your prescription now that will make it work for you, and I can change your lenses, but ma'am, do get a checkup also. So there you go. That's all. So I said it.
Thank you. I just guess I want to stress that if you're going to see a dermatologist and you're wondering whether or not the doctor that you're seeing is just an aesthetic dermatologist, then just make sure that they're board certified and they belong to the Philippine Dermatological Society. Whether you see me or you see any other doctor, make sure they belong to the PDS, because then you're going to be in good hands. And if you have any doubt, just go to the hospital and ask for a derm, because we won't be let into the hospital if we didn't have the proper credentials.
Yes.
So proper training. So, we're trying to, our best interest is for our patient. And if your doctor doesn't put you at ease, then there's nothing wrong if you want to seek a second opinion or even a third opinion. Sometimes, some patients, they're just not ready to accept that this is what they have.
Yes.
And that's fine, all in your own time. But do look for the proper guidance and the proper education so that you're informed and you're not just panicking about what this one person just said or what Dr. Google just said or what you saw on TikTok.
Yes. Listen to Healthline with Makati Med instead, so you don't panic as much. Okay, doctor, before we get into the other questions and stuff, we do have to take a short break. And guys, it's, stay tuned because we're going to learn more about psoriasis and maybe see a few more pictures and everyone likes pictures, and then we're gonna talk about
scary.
also the psychosocial. Yeah, we're gonna talk about, if the pictures freak you out and you feel scared. Okay, I'm gonna warn you. Sometimes it's graphic for other people, but at the same time, imagine how the people who have it feel. Okay, so I will say, when we're showing the pictures, and if you don't want to look, maybe it triggers feelings in you because maybe you have, you love someone who has psoriasis, and you're listening to the show to get more information, to help them, then okay, don't look at the pictures. But, afterwards we are discussing it. So please do listen to the discussion. Very important. And, this topic, I've not come across it before on the show to discuss it. So, hang in there. Just stay tuned for, or, take a bathroom break or something, then come right back, because we'll be right back. Healthline with Makati Med.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
World-class quality healthcare with a heart is now more accessible and affordable with Makati Med Care Access. I am Dr. Jacinto from Makati Medical Center. Our mission is to serve and provide compassionate care and excellent service to everyone who needs it. And now, we are bringing our renowned brand of world-class healthcare to where you are. With Makati Med Care Access, we have expanded our services beyond the hospital premises to serve you in convenient locations where you can avail of premium but economical healthcare. The Makati Med Care Access Araneta City is where we offer health screening and diagnostic procedures. Here, you can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. What's more, Makati Med Care Access Araneta City is the only single-use hemodialysis center in Araneta City. This makes it easier and convenient for patients to avail of renal care services right in the heart of Cubao. Here at 𝗛𝗶𝗵𝗶, another Makati Med Care Access Clinic is located, offering outpatient care like consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby communities who do not want to proceed to the hospital to have these treatments and procedures done. The Makati Med Wellness Center, located at Ayala North Exchange, is a warm and comfortable space where executive checkups and services for holistic patient care and wellness can be availed of. In this wellness center, we have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. It is equipped with modern facilities and has competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services to adult and pediatric patients alike. It is connected to the main hospital by a bridgeway at the side of Ayala North Exchange. To make our services more accessible to certain areas, the Makati Med Mobile Care Access was launched. As the name suggests, this service is mobile. We go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on what your community needs. We can go to any location of your choice within the metro and conveniently offer healthcare services to fit the needs of any community or group. For added convenience, different modes of payment are available, inclusive of HMO benefits for those with a valid letter of authorization. Now that is truly accessible healthcare. All these additional locations under Makati Med Care Access are meant to make it easier for more people to avail of our services. After all, access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For your healthcare needs, Please visit us at the following Makati Med Care Access Centers or contact us to come to you and allow us to take care of you.
You're back with Healthline, keeping you healthy, moderated by Nicole Jacinto.
Okay, folks, as my sister said in that voiceover, aha, it's a sister. She has got a great voice, doesn't she? You're back with Healthline with Makati Med, and I am the moderator, Nicole Jacinto. I'm your host, and we're here with Dr. Sharon O. of Makati Medical Center, and she's a dermatologist, and we're talking about psoriasis. And Doc, okay, so you have mentioned that there are different types of psoriasis. Can we just maybe like remind me what is the most common type, and what are, perhaps just mention some of the other different types, or how it differs, or how they differ?
Okay. Well, there are quite a few types. The most common is your plaque type psoriasis. So the picture that you showed earlier, with the white scales, that's
Perhaps
common.
we can show it now as we talk, AJ. Sorry, doctor, I'm talking to AJ, who's really, really, thank you so much, AJ, really patient and great with me. Okay, so
Perfect.
that's
so this
the
is your
most
plaque type.
common.
Yeah.
Mhm.
Then your next one. This is also your plaque type.
Plaque
Then
type.
next one. This is your gut tape kind of psoriasis. So if you can see, it's a little bit thinner, a little bit redder. This usually will tell us that the patient has some kind of strep or staph infection.
Oh, so like if you get a strep throat or Staphylococcus aureus, right? Infection, then okay. So
yeah, then this is the kind of psoriasis that you're going to get. So this is a little bit different because it's the psoriasis on your palms and your soles, and sometimes it can either it has pus like this. Sorry to be so graphic. So this is pustular psoriasis. This can happen too, just because you have a imbalanced immune system, and then your body can't fight off the usual bacteria in your skin. So this can happen too. This is your scalp psoriasis, which is very, very, very incredibly difficult to treat, and a very common reason as to why patients come to the clinic, because people can see it and it extends beyond your hairline. So we know that this is scalp psoriasis because usually if it's just like regular dandruff, first of all, it won't be this thick. Second of all, it won't extend past the border of your hairline.
Okay. All right. And of course, that's the nail.
Your nail psoriasis.
Nail psoriasis. Okay.
Nail psoriasis.
Also, yeah.
So this is your erythrodermic psoriasis, so or erythema, so your redness. So basically, your whole body is just red. And sometimes one of the triggers that I didn't mention earlier is if you go out into the sun and you get a sunburn, you can develop this kind of psoriasis.
Yes, because if you get a sunburn, this one or the photo before,
it can become like that too.
Okay.
Your plaque type, So that's your arthritis,
Okay. Wow. Okay.
Yeah. So that's your arthritis mutilans, which is, I mean, you can see how the fingers are so deformed already. It's like it's not even straight. And if you notice, they're shorter too. It's like, when you put in like a lead into the pencil, and because it doesn't open the top part anymore. And I don't know, sorry, this is giving away our age, but if you put it in the other way, the mechanical pencil, it's kind of like what happens to the joints. It kind of telescopes inward. Right. So you have like these pudgy, what you call subluxated joints. Sorry, I don't know what other. It's like telescopic joints, I guess, that kind of buckles in. So this is another example of your nail psoriasis, and people think that this is a fungal infection,
but it's not.
It's not. So this is because what will usually give you away is you will have skin lesions, not just nail lesions.
Okay. Thank you very much, doctor, and thank you for the photos, because that really helps with visuals. And for those listening, you're also describing it very, very well for them. And Also, okay, so those are the different types of psoriasis that you can get. And when you were talking about the sunburn earlier, yeah, because I guess if if you have a sunburn, your skin automatically your skin will be like, if you don't have psoriasis, it'll be like, I'm gonna shed this, right? So after a while, like, or it's a burn, so it's still a kind of injury,
Yes,
right?
inflammation still. Yes.
Yeah.
So you'll most likely develop inflammation due to the psoriasis.
Yeah. So if you have psoriasis, instead of it being like, okay, how typical sunburns act, where yeah, you burned it, but it's not that bad, or you wanted to get a tan, or you just went out into the sun and woo, there we go. Because a lot of us don't even try to get tan, but we do, especially living in this country where we're situated geographically. For patients with psoriasis, for people with psoriasis, it can cause a lot more inflammation, because then the body's like, oh my God, something got burned. We have to make more skin. Yeah.
Yes. Yes. Exactly.
Thank you, doctor. Okay. And okay, so we've seen the different types, and you've explained them to us very well. And by the way, for those who can see, this is like, if you have a lead pencil and then, you put in the lead and it gets cut. Yeah. Do people not use pencils anymore? I think they still do. They sell a lot of them. Or do they not believe that you make mistakes? No, you're telling me no. So like,
I don't know.
I think there are also like ball pens where you can erase the ink and stuff like that. I just cross mine out and I'm like, whatever, I'm confident. Confident that I can cross out my mistakes. Okay. When should you seek medical help if you suspect you have psoriasis? Like, okay, maybe for some people it's very small, or I have this on my foot or something like that. When should you seek medical help?
I always just go by, if you don't feel well, if you don't feel good, come and see us and let's see if we can do something about it. So that we can reassure you, or what we'll also do is we'll observe if it progresses, if it's nothing to worry about, we'll tell you too. So that's ease of it'll ease your mind. So if you feel unwell, don't ignore it. Come and see somebody so that we can properly advise you and try to figure out and try to help you.
Thank you, doctor, for saying that, because a lot of people will be like, I don't feel well, but I'm afraid to go to the doctor to find out. Well, what if it's not a big deal, right? As you said, if it's not serious, we'll tell you. So just go, so and you'd have fewer things to worry about. And then, doctor, can you tell us how psoriasis can impact the person's overall health, like in terms of complications, medical conditions? Let's stick with the like sort of physical medical conditions first. Like, I mean, what happens if you, first of all, like how far can it go? And then secondly, what happens if you don't treat it, but we'll talk about treatment after, like how exactly you treat it.
Okay. Well, I mean, are you asking like, is the mortality rate high, or can you die from it, or?
Yes.
Well,
let's go directly to that.
Well, from psoriasis, no, but from the complications from psoriasis, you can have a really horrible quality of life. You can get all kinds of infections. You can have what you call the erythrodermic psoriasis, where your entire body is just red and flaking and peeling, and you basically look like a longaniza.
Okay.
On the inside.
I'm gonna eat that anytime soon.
Sorry.
Gonna eat that anytime soon. Okay.
Nobody's gonna have longaniza for a little bit, but so you feel like you look like that, and you feel worse, and you feel like, what's going to happen to me? Am I going to get better? And if you don't have too many other medical problems, then yes, psoriasis is treatable. I think a lot of misconception is going towards treatment and prognosis is that people want to have a cure for psoriasis, and they think, oh, doctora, can you make me well again? And have to break it to them gently and say, I'm sorry, we can't, because this is an immune disorder, but we can give you the best quality of life that's possible. There are so many new treatments that are out. Psoriasis has been around for over 2,000 years. Not as old as leprosy, or not as old as syphilis, but I mean,
leprosy,
yeah, but leprosy is still around. So a lot of people are, in our part of the world, leprosy is one of those neglected tropical diseases, and people are like, oh God, is that leprosy? Is that 𝗪𝗀? What you have, so they confuse psoriasis between the two. And so going back to what you were asking earlier about the whole psychosocial process, it's this whole cyclical thing. And if you ever see a psoriasis patient, the majority of them are all overweight.
Okay.
Because they don't want to go out. They don't want to leave their house. They're ashamed. They're embarrassed. People don't understand what they're going through. And they just rather eat to make themselves feel better. They have joint pain. They don't want to exercise. They're covered from head to toe because they'll never wear black because it's like dandruff everywhere. There are scales everywhere whenever they go out. They're always so embarrassed because they leave scales. They leave like a mess of scales everywhere, and they're always, they just think people won't understand, and they'd rather just stay home.
Some of those, they never wear black. Some of it is because of dandruff. Some of it because like shedding skin too. I mean, like in different parts of the body. Okay, so let's get into the psychosocial now. And then maybe we can talk about how to manage, or what exactly are your treatments for psoriasis. But psychosocial is very important. So let's give it that space right now. And you're talking about it like a lot of patients are overweight because they eat their feelings or something like that.
Exactly. Eat their feelings. Please don't eat your feelings.
Yeah. I know sometimes I can't eat at all, and then sometimes I eat my feelings. So I get that, and a lot of people do, I think. And in this world where, yes, we have a lot of advancements, but it has become a more sedentary lifestyle. And that's been going on for many years, Doc. It's not just because of like us right now using our phones and stuff. I mean, it became like that because of like having to report to the office and sitting for long hours and all of these things. And, for people with psoriasis, do you find that they have a high unemployment rate?
Yes, they do.
It's hard. It's hard because, okay, as a society, we judge people by how they look. And then we should not make this mistake of thinking, if someone says I have psoriasis, oh my God, I don't want to get it. It's not contagious. Okay. Of course, you can't blame that inner voice and panic, like you don't want to get it because you don't want to suffer like the other patient, or you don't want to, also give it to someone else that you live with, but it's not contagious. And like if you have a gap or something, just know that if someone has psoriasis, then they have psoriasis, period. I know sometimes it's hard to get to that point, especially in our culture. And what would you think, Dr. Lim, when they go through all these psychosocial things, do you also recommend them to like, do you have to recommend some to psychiatrists or therapists?
Sometimes yes. But what is the most life-changing really is the medication now that's available for psoriasis.
Okay, can we talk about that medication? Yeah.
Okay, so
this is part of treatment and management, right?
The treatment and management. And, mostly when you're sick and as a patient, I understand you want a light at the end of the tunnel. You want your doctor to tell you, like, you can be as normal as you possibly can and enjoy your life. And, when you get psoriasis in your 30s, some people think like it's a death sentence. And like, oh my God, what am I going to do? But, there are treatments for it. So there are newer medications. Since we've mapped the human genome, we can, we understand the body a lot better. We still don't understand a few things, but we're able to make better medication now that's more targeted, more pinpointed on what needs to be addressed, and also with fewer side effects, better working medication. So there are biologics which are available, which are injectables. And
they're in like gene therapy in a way, like telling the body, hey, stop this. Okay.
Yes. like
They're
hey,
flexible.
control. You're like, you have all of a sudden a conductor conducting in the orchestra. Like, no, you can't do that. Yeah.
Saying stop, shut off that
Yeah. Like,
keyboard.
quiet. Yeah.
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 And
Yeah.
then,
So you
or,
have that. You
yeah.
have that. And so the medication. Sorry, my kids. Please go. Yes.
Oral medications, how about
Sorry.
that?
Oral medications, there are available, but they have a lot of side effects.
Okay.
And one of them is actually a medication for cancer, and we do give it because it's quite inexpensive. We do have to talk about the economics of medicine as
Yes.
well. These biologics, they're great because they will improve the quality of life by 100%. You can be almost absolutely normal. You will not suffer anymore from arthritis. And you can be completely clear.
Yes, you can be
You'll-
completely clear.
Completely
But-
clear as if you had nothing. It's really just the problem is the cost of the medication.
Expensive. Yeah.
Sorry, one second.
No problem. All right. So we're talking about the economics of medicine, and yeah, it's very expensive. And so I'll say it. Can the government do something about that?
Well, the government has tried, but I think they need to try a little bit harder.
Oh, they try a bit harder. Okay, so
A
they're
little bit harder, so that we can
try harder. So can the executive arms and the bureaus of approving things faster and lowering the cost, and probably big pharma. I'm a fan of yours, yes, because I need your medicines, but also maybe you can cut down the cost a bit. And
hopefully they can. They do. They try very hard to cut the cost of the medication. It's just really the medication is so expensive.
Yeah.
I mean, hopefully the government can subsidize a little bit more because the medication is really life-changing.
Yes.
Patients have suffered with psoriatic arthritis for years.
Yes.
With one injection, within a few hours, gone.
Oh my God. Okay, so you know what, government, maybe for another show we're gonna get up all in your business if we have to. And you did say earlier that actually they're telling me we're out of time, so I have so many more questions here. But
Okay, very quickly, the other treatments are UV therapy. There is methotrexate that is available. There are topical steroids. There are topical vitamin D derivatives, A derivatives. But the thing is, they don't work as well as the biologics that are available on the market. So we usually work with patients in, like the economics of medicine. What can you afford? How long can you afford it for? Because it's a chronic disease, it's maintenance. But at the end of the day, I think the take-home message is there is a light at the end of the tunnel and we can treat it.
And it's a better quality of life that we're looking for. You can treat it, you can manage it. It's better quality of life we're looking for. You can make the lifestyle changes that you need to or want to, and you do have the medicine for it. It's a bit expensive, and the government. And then
it can help a little, but if you're dreaming of going to the beach in a two-piece bikini, it can be done.
Yes.
If you want to go to the beach and be topless as a guy, it can be done.
You're not a girl. Okay.
Yeah.
Okay. Yeah, in Europe somewhere where they don't arrest you or whatever. Okay, so thank you, doctor. I believe we can learn and also have fun. We can talk about serious things, but also have some joy in knowing from people like you that, as you said, there is a light at the end of the tunnel. And last thing, what is that type of psoriasis you said again that you can qualify as a person with disability? That way there's a subsidy of somehow buying medicine.
Psoriatic arthritis.
Sorry, what's that again?
Psoriatic arthritis.
Okay,
psoriatic arthritis. Yeah.
Okay, thank you very much for being on the show, doctor. I had such a good time. I hope the people also watching, viewing, listening also enjoyed the conversation, and just keep watching and you'll learn more from Dr. Sharon O. Lim, and I'm gonna get in touch with you. Okay, but don't worry, I'm not really a doctor. Sorry.
Thank you for having me. I enjoyed it.
Please come back anytime and we can finish the rest of the questions on psoriasis or talk about another thing that you treat, because there's so many other illnesses, conditions, and diseases. Thank you very much for being on the program. Thank you, AJ, for being so patient. And like, you're not killing me right now because I went overtime. But okay, folks, so interesting. We ran out of time. Next week, we'll be back, Healthline with Makati Med. I'm your host, Nicole Jacinto. We've had Dr. Sharon O. Lim of Makati Medical Center, dermatologist. On our show today, our topic was psoriasis. Share the show if you'd like. Listen to it. Get into it. If you know people have psoriasis, God bless you guys. And there is a light at the end of the tunnel. Do you want to say hi to anyone, Doc, before we go? Before AJ kills me?
No, I'm good. That's what AJ was
Okay,
saying.
thank you. Thank you.
Bye.
Thanks, everybody. So see you guys next week. Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.